I'll be focusing on some of the key characteristics of inflammation, including redness, heat, swelling, and pain. Together, we'll explore how these features arise, their underlying biological mechanisms, and why they are essential for our health.
Redness rubor.
First, redness, known as rubor, is one of the most noticeable signs of inflammation. It occurs because of a process called vasodilation. During inflammation, blood vessels in the affected area widen or dilate, which allows an increased volume of blood to flow through the area. This vasodilation is triggered by chemical mediators such as histamine, released by mast cells, and nitric oxide, which relaxes the smooth muscles of blood vessels. The purpose of this increased blood flow is to deliver essential immune cells like neutrophils, as well as oxygen and nutrients, to the site of injury or infection. The visible redness is a result of this enhanced blood flow near the surface of the skin.
Heat. Health result from increased blood flow and metabolic activity.
Heat, or calor, is closely tied to redness because it also stems from the increased blood flow to the affected area. As blood rushes into the tissue, the warmth of the blood raises the temperature locally. This heat plays an important role in the immune response. Higher temperatures can create a less favorable environment for pathogens like bacteria and viruses, slowing their growth. It also speeds up the activity of certain immune cells, making them more efficient at eliminating harmful invaders. So, while the heat might be uncomfortable, it's an important part of the body's defense mechanism.
Swelling.
Next, let's talk about swelling. Known as tumor, results from fluid accumulation in the tissues, a process called edema. This happens because inflammation increases the permeability of blood vessels. Chemical mediators like histamine and bradykinin make the walls of the blood vessels more leaky, allowing plasma proteins and immune cells to leave the bloodstream and enter the tissue. This fluid brings essential components to fight off infection and repair damaged cells. Although swelling can be uncomfortable and restrictive, it is essential for delivering the tools needed for healing and protection.
Pain. Pain is due to pressure on nerves and chemical mediators like prostaglandin.
Let's continue with pain, or dolor, is caused by a combination of factors during inflammation. Chemical mediators like prostaglandins, bradykinins, and cytokines are released at the site of injury. These substances sensitize nerve endings, making them more responsive to stimulation. Additionally, the physical pressure from swelling further irritates these nerve endings. The pain serves a critical protective function. It discourages the use of the affected area, allowing it to rest and heal. For example, if you twist your ankle, the pain prevents you from walking on it and potentially causing more damage.
Together, redness, heat, swelling, and pain reflect the body's intricate response to injury or infection. While these signs might seem unpleasant, they are crucial for initiating the healing process and protecting the body from further harm.